And while the COVID numbers seem to be trending in the right direction here in Illinois, the number of people who are dying, that is going up.
And joining us to talk about the COVID death rate is Dr. Bala Hota. She's a chief information officer and an infectious disease expert at Rush University Medical Center. Doctor, thank you so much for joining us.
Great to be with you.
First of all, doctor, why is the death rate going up?
Well, so I think what we can expect to see is that the number of deaths in the state and nationally, we may see it day to day fluctuate a bit. But it's really important to recognize that since the peak in February, we've seen pretty dramatic declines in the number of deaths. And I think in the longer term, we can continue to expect that to go down.
Well, doctor, is this just part of the process? This is just how it happens when you have an epidemic like this that goes over time? Or is this somehow tied to vaccination rates?
I think that we've seen a lot of successes. We've seen that the vaccine has been really effective. It essentially dramatically reduces the risk of severe disease. But I think we do have to recognize there's still a hesitancy to get the vaccine among sections of the population. And so to the extent that we can, continue to promote the use of the vaccine, which is very safe and very, very effective at preventing severe disease, that'll do a lot to get us out of this phase of COVID where we still have ongoing cases.
Doctor, do you find that because the vaccine is out there and a lot of people are being vaccinated, that people are letting their guard down now? And that could be a problem come fall and winter, can't it?
Yes, we're seeing there's ongoing transmission that's happening, and there's still quite a bit of COVID, SARS-CoV-2 infection that's out there. So we shouldn't let our guard down. And that's why CDC has been, I think, cautious about reducing the times we use masks. We're seeing infections that are ongoing in younger populations, and that's why this extension of the vaccine to adolescents is really important and will really do a lot to continue to reduce the infection rates. But we I think, have to keep our guard up, and when we're indoors, we should use masks and really follow CDC's guidance around the use of masks.
I don't know how deep we can get into the statistics of this, but have you noticed a certain group, or whether it's race or an age, that is falling into these higher death rates, or is it too early to tell?
I think it's too early to tell. What we are absolutely seeing is that hospitalizations and death rates have gone dramatically down in the high-risk populations that we saw before. So the older population and those with immunocompromise. And what we're seeing is that, in fact, hospitalizations are now a younger population. But the overall rates of everything have declined. So I think we're going to see it trend younger because that's the population that is resisting the vaccine or hasn't gotten it. And so I think the more vaccination we get out there, the more shots in arms, the better we're going to be.
You talked about mask wearing, and a lot of people are saying, you may not have to wear masks outside. Some municipalities may be taking that on. What is your take on that?
Yeah, so I think the CDC guidance, I think, is really quite good. There's two big things to keep in mind. So one is, when you're outdoors, the risk of infection is lower because it does appear that it's some combination of droplet and airborne spread. And so when you're outdoors, it's harder to be in an environment where you can be exposed. The other is that the asymptomatic, there's a risk of asymptomatic infection. So people may be infected and not even know it. And those individuals can then transmit the virus. So wearing masks indoors where there's the highest risk of spread, even among people who have been vaccinated, even among people who don't have symptoms, helps us all as a community and reduces the chance that there's transmission.
Dr. Bala Hota at Rush University Medical Center, great to talk with you. Thanks for your time tonight.
Thank you.